Hello, this is Dr. Charles Shidlofsky, and we have a new episode of the Neuro-Optometry vlog for ODs on Facebook. Today, we're going to talk about sports vision. Recently, I just returned from Poland, where I gave a few workshops with a few colleagues on sports vision, and it got me thinking about what are some of the very basic things, if I want to get started in sports vision, what are some of the basic things that I need to be able to do in my testing protocols to be successful at doing sports vision. So that's kind of what we're going to talk about today. And these are tools that we all have in our offices as of right now. So that's what I want you thinking about. The best tool that we can have is good education. And there's a couple of good resources for education. The International Sports Vision Association has an annual conference every February. This past year it was in Orlando, and next year it's going to be in Dallas. And basically it's a 3-day conference just on sports vision with vendors and things of that nature. So you really get a good glimpse at the whole world of sports vision that way. And you can really take some good coursework there. But they'll also be having some a video series that's going to be available online throughout the year. So keep an eye out for that. And a good way to do that is to go to the website sportsvision.pro. That's a .pro. Go to that website, take a look at the information on there. There's some great resources on there for you as well to get started in learning about sports vision. So let's just jump into testing now. And for vision testing, we can't think of it in the same way as we think of a routine exam. It's not only good enough to do the test, but we have to get a qualitative element to that test. So does it take significant effort to do the test, or is it done with ease? What is their posture like? Look at the patient, kind of get feedback from them on what they're doing or what they're seeing. And don't forget, for athletes, average visual measurements are not sufficient for superior athletic performance. I always say the most important test we do in all of optometry is the case history. So it's important to get a good case history specific to that individual athlete. So we want to know when their previous eye exam is. We want to know what their correction is, whether they wear contacts or glasses. Have they done any training? What's their performance like on the field? What is their ability to visualize? And what's the importance of vision in their sport? And once again, one of the resources we have on the website is a vision performance history form that you can download and personalize. So definitely have a look at that, and it makes it so much easier to use something that's already created. So let's jump into some of the testing. And the first test we always do in our exams is visual acuity. But you got to understand, for an athlete, 20/20 may not be good enough, or may not be sufficient for optimal performance. So I'm always looking to see, can they get to 20/15? Can they get to 20/10? And also it's important to do both static and dynamic acuity as well. So look at different types of acuity. Color vision can be important in certain sports. Can you imagine a race car driver not being able to see color? That would be a big problem. Contrast sensitivity. Once again, with contrast, there are certain sports where contrast can be a major factor, but sometimes it's a surprise, and you may have bad weather conditions that you're having to play your game in that can create contrast issues. Eye movements are critically important, and it's really important not to see if we have good ocular motility, but we have to look at pursuit movements specifically. We have to look at saccadic eye movements specifically. We have to look at their ability to fixate as well. And there's some great tools out there to do that, but you can do simply in an exam room, set them up and do these pursuits and saccades and fixations in their exam room. And what I always say to do it with athletes, you have to you can sit them in the chair and do it, but then you need to put them in their athletic position to do it as well, because that's their position, that's how they're holding their body for their particular sport. When you're looking at eye movements, we have to look at range of movement, ease and comfort of movement. Look for restrictions or nystagmus, their quality and ability to sustain those eye movements. So those are some important thought processes in that. Accommodation can be important in certain sports. So get a good amplitude of accommodation. And I love to do accommodative facility as well, how quickly they can accommodate. As far as binocularity goes, cover test is critically important. You want to see how it is at distance and how the cover test is at near, but also in multiple positions of gaze. If you're working with a basketball player who's looking up, you got to make sure that their phoric measurements are the same as it is straight ahead. So those are some important aspects of that for right now. One little tool that I like to use is something called the Thorrington Foria card, and that is a card you can purchase through Bernal, I believe, or Goodlight, and it's a real quick, easy way you can measure foria in different gaze fields. Ocular dominance can be important, especially for younger athletes, so definitely get an idea if they're right eye dominant, left eye dominant. Depth perception. Now, most of us do depth perception. We give them a stereo fly test or something of that nature, and we do it up close. But really, for most athletes, distance depth perception is really more important. So for distance depth perception, Bernal makes a really nice distance depth perception chart. But many of our electronic charts also can do depth perception as well. Particularly like the M&S stereo system that's available out there has a really nice depth perception test. One of the other things I like to do is check their ability to adapt. So you might put some prism lenses on the high-powered prism and see how they adapt to things visually as well. Another thing that I like to look at is balance. So I stand them up in the room and I look at their balance, and I have them do it with their eyes open and eyes closed. Tell me, is there a difference between the two? Really important thing to find out. If you find that their balance is worse with their eyes open, it tells me something's going on in the visual systems that's disrupting balance. And obviously for most sports, balance is a very critical aspect of it. There are electronic ways you can measure this as well. So those are some really basic, simple tests that we can all do in our exam rooms to test the athlete. So next time, what I hope to do is come back and talk a little bit more about sports vision training and different training techniques we can do for the athlete. So until next time, we'll see you soon.